You ask if I trust my judgment more now than I did when I first came 30 years ago. And the answer is yes, I do trust my judgment now. You ask me why? Why should I? My answer to you is experience. When I first came here, I had no experience whatever. It qualified me to address the issues that this court is required to address and decide. And now, after doing it for 30 years, I have much more confidence in my judgment than I did then.
This man is more than 80 years old. As far as he's concerned, and most would agree, his mind at this advanced age is as sharp as ever. This man is almost exactly the same age. But last year, he started having problems with names, including his own. Tonight, he will forget how to return home. And tomorrow, he may no longer recognize his wife.
You know what it's called?
No, I'm almost. I could take a little time, I think.
I'll give you a hint. Begins with an H. Sounds like ha.
It's frustrating to
I know.
Yeah.
It's a harp.
Harp,
That's
yeah.
right. That's right.
For one, the future ended forever last year. For the other, each new year seems an improvement over the last. The positive change with age, as the 17th century Dutch master Rembrandt observed in himself, begins long before old age. For the artist, the gathering maturity might have been no more than a passage of being, the grave impress of time. Today, Rembrandt students and modern scientists may share two beliefs. In old age, creativity need not diminish, and wisdom may flourish. Before our eyes, Rembrandt's technique grows in subtlety. Vanities fade. And within this life passage is evoked the fermentation of experience, the encumbrance of self-doubt. From these brushstrokes of self emerges Rembrandt's particular wisdom, punctuated just before death by the master's final offering, the unforgiving statement of who he is and how he had come to be.
Wisdom for me, foremost, is a state of knowledge about the human condition, about how it comes about, which factors shape it, how one deals with difficult problems, and how one organizes one's life in such a manner that when we are old, we judge it to be meaningful.
On this cart that you see alongside me, of this week's accumulation, there are better than 100 cases, every one of which I have to look at.
For a justice of the United States Supreme Court, wisdom has come to mean the distillation of a lifetime's experience.
And I do this every week. I have no difficulty handling it. If anything, I expect the experience I add to year after year as I've just made it rather easier.
The wise person evaluates the situation in its own light, not coming from a predetermined position. That's the essence of wisdom, to be sure you're looking at the current situation in its own light. So it's very difficult to be wise if you're doctrinaire. It's difficult to be wise if you're impulsive, to be so bound and determined by your own motivation. It's also very difficult to be wise if you don't have enough experience. Not all people make it. Not all old people are wise just because they're old, but some do, and for me that's a fruition of life.
Identical twins, Bert and Hugh, now 81, were raised together and lived not far from each other. One of them must have confronted the trigger for Alzheimer's, for today he exhibits the symptoms of dementia.
We had some kind of a thing that we could go up there, but it was too far to go. There's nobody, I don't think, ever went up there at all. I go out in the water.
Well, in looking back on this change in Hugh, it was not perceptible, but something in our relationship had sort of slid apart. And that would be 3 years ago or 4 years ago. By 3 years ago, there were gaps and phrases and cover-ups on his part. You know, I didn't pay much attention to it. But looking back on it now, it seems to me that this was part of the beginning of this, of some kind of change of mind.
Like this. Oh, you'll remember him very well, because he came down to us all the time. Then we went up to Aunt Mary. Not Aunt Mary, what was her name? We'd go up there and spend the night or something like that.
In Charles River?
In Charles River.
Yeah.
And he lived in sort of down, there was some water place down in here like this.
Hugh has Alzheimer's disease, and the symptoms that he has are very typical for an Alzheimer patient. He has a great deal of difficulty with his memory, and that's gotten gradually worse over time. And he has trouble finding the words to say what he wants to say. He has trouble with naming, and that's also gotten gradually worse as time has progressed.
Falling over. Oh, it's marvelous. Out of this world.
And here we are in Cohasset in the tree.
Well, this not us, people much younger.
No, it's us.
Oh, that's what I'm trying to figure out. Which is which? I think I'm this one here.
Yeah, I think so too. And here's Marty in our usual, she'd no difficulty to play that game in here with the Tweedledum and Tweedledee.
Yeah, yeah.
Remember that?
Look at pointing out here, this marvelous thing. Who's this?
Our oldest sister, it's Marty, in her usual position of commanding things.
No, the voice.
Hugh has a great deal of trouble going from one subject to another in any sort of a logical fashion. And because he has trouble in finding the words to say what he wants to say, and his conversation is filled with its and theys, it's also very difficult to follow him. The thing that's so remarkable is that Hugh and Bert have so many shared experiences that Bert is able to understand what Hugh is trying to say. It's really a mark of Bert's successful aging that he's able to communicate so well with Hugh.
I think that's me on that side. I think you're the good-looking one on the other side. The skills that he lost were with numbers, with spelling, with writing, of doing things neatly, which he did with great precision in playing golf and painting and other things he did.
And what's your memory like now? Is it as good as it used to be?
Oh, it would come back quickly.
You think that if you tried to remember a room full of names, you would be able to do it?
Yeah, I'd be able to do it, but I'd have to tune up a little bit on it, like golf or anything. You have to get going on the thing.
I have some pictures here. Maybe you can tell me what the names of them are. What about this one? Can you tell me the name of it?
Well, I'm thinking you could play some kind of a machine.
It's sort of like that, except you put it in your mouth. It's something you blow on.
Oh, I know what you mean.
Yeah.
I can't remember the name of it, though.
Begins with the letter H. Sounds like...
Oh, I'm just on the edge of it. I can't quite get it. You blow it through here.
That's right, that's right.
Children,
Harmonica?
children have it, don't
That's right,
Yeah.
exactly, exactly.
Harmonica.
Right, right. What about that?
Oh, that's a wonderful one. That's
Yeah.
a terrific thing. Way out in the bush.
That's
Right
right.
out in the bush
that's
with
right.
great big things going around, and they're going to wipe people up.
Yeah, yeah. And Africa is where they live, don't
yeah,
they?
yeah.
Yeah. Do you know Paul? Begins with an R. Sounds like ruh.
Veronica, I can almost get it, but I can't quite get it.
Rhinoceros?
Rhinoceros,
Right,
that's it. Yeah, I got a
that's
big
right,
thing
that's
sticking
right.
out. Then I got it.
We now believe Hugh is unable to succeed at this child's game because of accumulating deposits called plaques and tangles in the higher regions of his brain. At the core of the plaque is a recently studied protein called amyloid. Around it, nerve terminals have begun to degenerate. Tangles are composed of two filaments wound around each other in a helix. While these structures also exist in the brains of normal elderly, only in those suffering from dementia, like Hugh, do they proliferate.
How about this one?
Flower.
Excellent.
And
What about that?
That's enough.
What's that called?
That's enough.
That's enough?
That's what the answer is,
Yeah.
yeah.
You don't like to do these funny things. You
No,
just
I
like
don't
to
mind.
talk.
It's only
All
done
right.
last time.
Okay.
No, I feel like a fool that I should know it. see.
No, they're hard. Not everybody can do that. It's not easy.
but I don't like to go against it because it's dull.
When it's
Anything
a little
dull.
bit hard, then you don't like to do it.
It's terribly dull. You see, it's good fun in the beginning, then it's just a bore. And I don't think that you're a bore. So that's the end.
Hugh is a very proud person, and he seems to want to appear as normal as possible. And so he's developed a lot of strategies for acting normal and overcoming the difficulties that he has.
It's devastating because Hugh has lost, and I think this is something he senses himself, but denies it at the same time. And that is that he's losing himself, he is losing Hugh. And this appears in his relationships. And his relationship with me goes back in a terribly deep way as a twin. I sometimes worry about myself. I mean, I have this, maybe this inheritance. My father had Alzheimer's or some kind of a dementia, a similar dementia. Our oldest sister, Marty, has been 6 years in a home, in a nursing home in California. And I find myself, but after all, I'm 81 years old, and anybody that age has to grasp for words. I can still come up with some extraordinary words. Apparently, he has Alzheimer's and is a victim of it, and apparently, so far, I have not. And here we were born 10 minutes apart. Was there something there? Who knows?
The only way to make a definitive diagnosis of Alzheimer's disease currently is at autopsy, by examination of the brain after the patient has died. We know there's a genetic component in Alzheimer's disease, and that in some people there is a gene defect that's responsible for the disorder. But looking at twins makes it very obvious that that's not the only thing that's important. Something has to happen to trigger the onset of that genetic problem. The nature of that trigger is really going to be important for understanding what to do about Alzheimer's disease. It could be a virus infection that makes the disease come on. It could be something simple in the diet. Once we can identify that trigger, we're going to be able to prevent the onset of Alzheimer's disease. It's not a cure. It's a means of preventing the disease from ever occurring. And I'm confident that we can do that.